This morning, everything is quiet up in quarantine and intake, but that's not going to be how it is for long. We're through the buyout program, we're just going to have to see how it goes today. But there's something like 45 horses scheduled to come in. How many are we going to actually rescue? We can't say until the end of the day because we don't know exactly how many are going to come off the trailer. But every single horse that we're rescuing today is $450. And it's a huge financial commitment. And I am so thankful for everybody that donated and everybody that will be donating. But for now, everything's clean. It's all ready. And the horses are showing up now. Now the horses are coming off.
So got the first load of horses here, looking over their health certificate in Coggins. It looks like most of these horses were purchased at auctions in Ohio, looks like maybe Missouri, 3 different auctions here. So these horses were definitely collected all up. We used to go to the auction and get horses that had been, from auctions in Ohio or whatnot and brought to Tennessee.
So trying not to show the trucks and trailers just to protect the privacy of the people who do bring us these horses, because surrenders are anonymous and the buyout is anonymous. But this is a big trailer and there's going to be a lot of horses coming off this trailer. Oh, look at that front leg. Oh, have mercy. First horse off the trailer and it's got a broken leg. You poor baby. That is so sad.
The bay horse right here has evidence of radial nerve paralysis. When you have a severe trauma to the shoulder, you can paralyze the radial nerve, and unfortunately it's a permanent change and you lose function of the limb, even without doing additional diagnostics. That is what's going on with that horse. And he's having to just drag his leg around.
There's a lot of critical horses in this load from what we're seeing, but he's the worst. He cannot use his leg here. It looks like he is a standard bred, so we should be able to find out his history. Oh, poor guy. Oh my goodness. Oh, does that feel good? I'm scratching. I do not have a mic on.
I know. Oh.
That draft horse is really big. Does that feel better? So the story of this horse is he was probably a standard bred cart racehorse, and then injured himself. Could have injured himself on the track, and his owners did not do right by him, or he went from the track because he wasn't winning onto maybe the Amish. He came from Ohio, and you're all right, bud. And then injured himself there and just was never treated. From the length of his hooves, you can tell like he's been this way for quite some time. From that growth, it looks like at least a good probably year and a half of growth on those hooves. We're gonna shave down his brand so Kimberly can get a picture of it and we can see who he is and where he came from. Let me get some.
I just want to see if he can flex his elbow. So this joint is fused. I can bend a little bit this way, but I can't extend this part of the foot out, and this would have taken months and months. There's a huge bony callus right here that's keeping this joint from functioning. This horse sustained some kind of severe trauma, and then the shoulder is completely dropped, and you can see a ton of atrophy right here. The radial nerve runs right here in his armpit along with the brachial plexus, and when we have severe injury to that radial nerve, you have the shoulder drop and you have no use of the forelimb. And then it's especially hard in horses because they bear 60% of their weight in their front legs. So he's having to try to compensate and hold 60% of his weight on this right front leg. And he's shown a pretty strong pain response on palpation of the left shoulder. He's got a digital pulse in this right foot. This horse has an indication of active founder in this support limb, which is likely secondary to, normally when we see laminitis, it's a metabolic process, but we can have it secondary to having to bear more weight than is necessary, and it's very painful. This horse also hasn't had farrier care for, his heel bulb should end right here. So this is severe neglect following a traumatic injury.
And he's been through one auction already and would have been headed on to another one. So they're selling horses at auctions like this in the United States, and nobody cares. We care, obviously, but like nobody's at these auctions. Like some vet pulled blood on him at the auction,
He has a certificate. He has a CVI.
Yeah, he has a health certificate. He's got all these things that, for bringing it. It's just really frustrating. It's really frustrating. But we're thankful we were able to intercept him from the auction, and this is why your donations are so important. This load of horses cost nearly $10,000 just to purchase them, and it's crucial that we are able to save horses like this. Like, he's super sweet. He's like, at first he didn't want to be caught, he didn't want anything, and now he's just like, he's not sedated, he's just like loving the chance to be loved. Yes, I know. Yeah, I feel good. I'm sorry, baby. I'm sorry.
This horse's heart rate is 68 right now. He did just get off a trailer, but he's being very calm. Upper end of normal is in the upper 30s for horses. So an elevated heart rate is one of our best indicators of pain. So this horse is very painful, and I'm going to give him some intravenous pain medication that's going to kick in really quickly. Very good boy. He's also pretty dehydrated.
The last act of kindness will be our only option for him. And it's something that is a gift when it's horses like this. Like, they are suffering so much, and we can relieve that suffering from them. And without us, he could have gone on to slaughter. And there are some folks that are like, well, horses should be slaughtered. Like, when I was in Washington, D.C. last time, they're like, I am pro-slaughter, but I'm against abuse. This is out of the slaughter pipeline. This horse is suffering. Abuse and the slaughter pipeline go hand in hand. All right, I'm gonna move him for your photo.
You need photos.
Yeah, He's had Banamine now, so.
Next trailer is here, so we're going to be moving these guys down, and we're going to make room for the other trailer to get unloaded. Then we'll try to work through the critical ones, and then go through and get vitals, make sure we get pictures in every single one.
How many horses came in the first trailer?
First trailer was 19 horses. I'm not exactly sure how many is in the second load, but we're about to find out.
Let's see how many come off.
Yep.
How old is he?
So he's 5 or 7 years old.
And he does have a brand, so we can verify that, but he is
So the other trailer is here. We're gonna have to give him the last act of kindness. There's nothing we can do, and his heart rate is showing that he's in a lot of pain. I'm probably gonna put him in a stall just for a second while the next trailer unloads, but he is a high priority for us for the last act of kindness because his pain levels are very high.
Okay, the remaining 18 horses are being put down in the holding pen down here. And we're going to be backing up a trailer soon. And I guess we do have some that are already in the chute, waiting for their initial intake and assessment. But the next trailer is already on its way, so.
Corey's been rearranging the quarantine area, and I think this is a much better setup. Like, it narrows down, and we can spray the spray paint, which the spray paint is an identifier of which trailer load they came off of, because we rescue so many different horses with so many different trailers that on these big buyout rescue mission days, it's hard to keep track, like, hey, that is that group. So the spray paint really helps with that. The next trailer is here. I need to post on Facebook so we can update people. We need donations. Donations are down this month, and
It's tax time.
huh?
It's tax
It's
time.
tax time, but there's still so many horses that need help, and if we don't rescue them, they'll just end up being another number on the USDA slaughter export report. We're still banned from the auction. Basically, the auction decided they didn't want us there, probably protecting their kill buyers. And now we're trying to just intercept as many as we can from going to that auction. So the horse that's really critical, you know, he had multiple auction tags. Like, you see where auction tags have been on him. So he'd been suffering like that for quite a while. So really thankful we were able to intercept him. He's a young, beautiful horse, but sadly his body is broken.
Do I make you weak? Do I make you stand a little taller when I follow your lead? When I can't admit it, do you know I'm scared? You make me wanna quit.
So on the right, her heart just sounded really muffled. Here, you should be, it's very obvious it's the second heart sound.
And hurts like a broken heart by someone.
I'm not a cardiologist, but she has a pretty severe heart murmur. We grade heart murmurs from 1 to 6, and I would grade hers at a 5 to 6. You can almost feel the murmur, and you can hear it with every heartbeat. We also assess point of maximum intensity for heart murmur. So there are 3 heart valves on the left, and hers is a PMI over the mitral valve. So what often happens with age is that mitral valve gets weaker, and instead of closing crisply, it kind of flops, and then we have blood flow back into the heart. She likely has an enlarged cardiac silhouette. So she is, I can't say with this information whether or not she's in heart failure, but she is probably headed for heart failure. So it's a pretty severe murmur. And let's check her.
'Cause nothing hurts like a broken heart by someone who loved you.
So we just brought this horse through the chute. We had determined that it's around 30 years old. We were going to do follow-up diagnostic checks with it tomorrow by getting some x-rays on its mouth to see its teeth. However, we did pull it out and we did check the vitals, and it turns out she has a really severe heart murmur. It sounds just really awful. It's like a dub, that should not sound like that. So unfortunately for this horse, I'm not sure if there's anything we can do to help it. And
Poor mare has a lot of problems that we see pretty often in these groups of buyout horses. She's probably upwards of 25 years old. She's missing a functional occlusal surface on both sides of her mouth, so she really doesn't have the ability to chew her food. She has a grade 5 to 6 heart murmur that's very severe, and you can actually palpate she's got engorged vessels running along her chest wall, so she likely is headed towards heart failure. And she also has active evidence of an inflammation in both of her eyes that's reducing her vision. So anterior uveitis is the most likely cause, but that can cause pain as pressure changes in both of your eyes. So unfortunately for her, some of these things we can manage, but heart disease specifically, especially at this stage, we don't have any treatment options for, and we don't want her to suffer a cardiac event and pass. So we're probably going to recommend the last act of kindness for this mare. She needs more cookies. Okay. Yeah.
'Cause nothing hurts like a broken heart by someone who loved you.
First trailer had 19 horses. Let's see how many come out of this trailer. Very first horse out of that last trailer was so maybe problems. This one's looking pretty good here. It's pretty skinny. 2, 4, 6, 8, 9, 10. It looks like. Oh, that one fell. Oh no. Oh, the poor horse.
hold on, tell me, hold on. Oh no! Okay, that works. Grab it.
Watch it, Jordan.
That's a bad spot to be.
Yeah,
Jordan, move.
You gotta
This horse doesn't look like you can see it all out of the. Do you want me to do it?
That's good. That's good. There you go. Step away. Step away. Yep. Don't want to get kicked. There we go.
Yay!
Okay. Good.
All right, can we close that gate, please?
This horse is an older gelding. He has a wound on his right hind leg that feels warm. He's got a puncture wound. It looks like somebody clipped it. I treated it with just a topical antimicrobial, and then he had systemic pain and anti-inflammatory medications and systemic antibiotics. He needs a sedated dental assessment plus or minus dental work, and he also needs radiographs. He's got, looks like a pretty severe scarring over the right carpus and in both hind legs. So he is stable for now. We also gave him some probiotics and some electrolytes to help stimulate eating and drinking, and he's going to go in a holding pasture until we can do those diagnostics probably tomorrow.
Cool.
Ooh, that right hind. Wow. Hey, Caitlin, I'm really sorry to ask you, can you turn back up?
So we had a little change of plans, and he's actually going to get his x-rays right now. Not Keith, the horse.
Yeah, I was watching this horse go out into the field, and he actually has pretty severe rotation of both of his hind legs, and he's kind of winging and paddling. So we know this leg is swollen. We don't want to assume that it's just something superficial, so we're going to go ahead and bump his radiographs up on priority so we can see exactly what's going on underneath there.
And while Dr. Lydia is doing that, Dr. Gina and Kimberly and Corey over here doing photos and taking notes and assigning numbers to the horses. So we have 2 stations working full time. We have 28 horses so far. It's a very, very busy morning.
Park, yeah, you got little cuckoos everywhere.
Yeah, look at all of them. Yeah. It's got them embedded on the hair over there. Got me. Yeah.
I'm sorry. This is why. I gave you so many cookies. Because that's kind of
I
important.
don't even know what that does. So.
Well, it does a lot of things. Thanks, Caitlin, for taking that off.
You have priority, by the way, if you need a
Okay.
shot.
All I heard was yikes.
Yeah. Okay, drop down towards the floor. More. Yep. I didn't get your fingers in the primary beam, but I can see your fingers through your glove. So this is why radiographs are really important, because we could look at this and be like, there's no way that we still have 3 functional joint spaces, but you can see this is the carpus. We have proximal, middle, and distal carpal joints, and they're all still functional joints, but then when you look at the other side, we have really severe arthritis and osteophytes and kind of some bridging, and then actually the big main part of that bump is all soft tissue. So we're really only able to evaluate bones on an x-ray and kind of make assessments about soft tissue structures, and so we can see this big enlargement right here. This is probably the set of synovial structures surrounding the carpal joint. Let's go ahead and do the right. Ready? Oh, there's almost no bony pathology. Okay, let's go for the hock. Good boy. What a good boy he is. That was patient movement. That is non-diagnostic due to movement, so let's try that one again. So this is all soft tissue. We just finished taking some radiographs on this sweet older gelding, and sometimes fractures and bony changes are worst case scenario, but actually, if you ask any orthopedist, sometimes soft tissue is actually worst case scenario. So in this horse's case, I don't know if you can see, he's got atrophy on both pelvic limbs, but on the right side, he has really severe atrophy in front of his pelvis that indicates that the injury to the right hind leg is actually higher up. So we took images of the stifle on the other side that was normal. He has a little bit of age-consistent arthritis, but he's got pretty catastrophic winging and paddling of both of his hind legs that indicate he has a more severe injury higher up. And we can't image soft tissue structures well on an x-ray. We can only make assessments about them based on bony changes. And in this horse, he has evidence of complete, pretty catastrophic soft tissue tearing in those hind legs. Muscle atrophy gives us an indication of how long ago that happened. So this horse is in a very poor body condition, but he has a lot of evidence that this has been going on for a long time. He has signs that he's been laying down a lot to try to compensate for pain. So in this case, I don't think there's anything that we can do medically to treat this pelvic injury. His heart rate is also elevated, which is an indication of pain. It did come down with the administration of pain medications, but his long-term prognosis for return to comfort is not good.
We are going to give him the last act of kindness. He's had lots of pain medicine on board. He's also sedated. He's so painful that we don't want to do x-rays while he's alive. So his x-rays will be taken after he is gone, just to document his damage and this just torture he's gone through.
So yeah, I can explain this.
Like another horse can work periodically, but it's not going to be able to.
We don't have complete collapse or arthrodesis of these joints, but you can see the horse's leg should be a bony column that's lined up. So see how this area isn't lined up with this area? So we almost have like a subluxation in this direction. And that is probably because this horse has been trying to kind of walk and knuckling over on that leg right there. When arthrodesis occurs and a bony callus forms, you actually have more stability and less pain. In these cases where we have really severe misalignment, you end up with kind of bone grating on bone. So this poor horse, when you felt this area and when I tried to move this joint, we couldn't move this joint forward. So we know that we didn't have a functional synovial structure in place, but we don't have a bony callus formed yet. So I would put that horse's radial nerve injury at probably 6 to 9 months before now that he's been walking around painful on that leg.
And it was really young, so
Yeah,
it's really sad.
young and super sweet, very beautiful, well-behaved horse. This is a case where radial nerve paralysis isn't correctable. So in dogs, we can amputate the limb. In horses with a forelimb, we really can't support that animal. And then we end up with the support limb failing.
This is one of Corey's little buddies.
Maybe.
Well, it's a mule.
Yeah. Hey, where are you going?
have everything. It's already ready.
Come on.
I already have it pulled up.
You already turned around once. You can turn around again.
Corey likes all mules, not all mules like Corey.
Yeah, well, not all meals like people.
Yeah, this is true.
That's usually a problem that happens before I get to them.
Emily's trying to catch another horse. And it'll do the intake on it. Yay, she caught one. All right. Good job, Kimberly.
Dr. Gina is going to run a CBC and a chem lab on this horse. I wasn't a part of that. Oh, she was half blind.
Oh.
Yeah, she's half blind.
Cool.
I wasn't there for.
I think I heard it's like an old,
diagnosis.
like mid-20s, something like that.
It's very nice, so normally it is. Yeah, she's an older girl.
This sweet girl, we were thinking she was going to be okay, but then she has a very significant heart murmur along with some other medical conditions. So we are going to be giving her the last act of kindness. And again, it's important to think about where would these horses be without us. They would be taken to an auction tonight. They'd be ran through the auction and most likely be shipped to slaughter. It's intercepting them and giving them that somebody cared in the end rather than just turning a blind eye to them. It's rescue work is really hard work, but it changes the world for them, even if it's for a short time.
This is a big horse coming in here. Wow, the last one was a little mule, and this one's a big horse.
My guess on his height will probably be right around 17, 1, somewhere in there.
Nice.
17.
Pretty big.
Kimberly whispered the answer in my ear, so that's how I knew it.
This is trailer number 3. We've gotten 28 horses so far, and I'm not sure exactly how many are on here, but we're gonna see how many come off. Corey's getting it opened up. There's 2, 3. Five, 6, 7. Get don't have to get right in my way. There you go. Eight. Oh, that one's got a major injury. Nine, 10. That will put us at 38 horses so far today. 38 horses. That's so crazy how many horses we've rescued so far today. Oh, 38 so far. This horse has a very severe injury on his back right leg.
Emily,
You can see it there.
You get in the cousin photo.
Emily's just getting the
You turn
intake
her back
photos real
towards
quick.
the gate, towards the fence that way.
Oh,
Yes. Let's get her some Banamine.
so Dr. Lydia said that her heart rate is 80, which is
Yeah.
high,
Maybe
and she
PO.
has a grade 2 heart
Pretty
murmur.
volume depleted. You can see how slow her jugular refill time is. So normally I would grab IV pain medications, but in her case, her circulating volume is so low that I actually think it's safer for her to have pain medications orally. So we're gonna get those on board and then we're gonna take some radiographs of this. No, it's very hot and swollen still.
Trying to get them all done in one day.
So we're gonna get some radiographs of that, but first we'll get some pain meds. Stop? No, it's a mare, I'm sorry.
Oh. I just want to like get up in there and make
Yeah.
her uncomfortable.
Is it lower? I'm not sure we're gonna see anything on radiographs. Everything that I'm palpating
be
is all
soft
soft
tissue.
tissue.
Okay.
But see right here, so that
Yeah.
is origin, insertion point of soft tissue stuff. Let's just keep going down.
Yeah.
So that's abnormal right there. That is probably the insertion point for the soft tissue that's
Oh,
damaged
that
up here.
little. Okay, that makes
Yeah.
sense.
There should be 2 more joints associated with the hock, and they're in various states of collapse right here. So here's a joint space, here's a joint space, and we should see 2 more joint spaces here that are non-existent.
Like basically.
So heart rate is 60, which is still 20 plus beats per minute higher than average. These intake days have been really tough. So far we've had 1 horse out of the 7 that we've looked at that didn't have something catastrophic wrong. So it is really difficult. We just get sometimes pictures of these horses ahead of time, and we're always optimistic that we have problems that we can treat and animals that we can save. And it's really heartbreaking to have so many horses come in with problems that we can't solve.
Yes,
So that horse over there, which is number 3 in line, is the 100th horse of the year for our buyout program. We have a lot more horses that we haven't started intake on, but it's the 100th horse.
Not the 100th animal either.
No, just the 100th horse in buyout for the year.
But it's only March.
It's only March, and we've got more than 100 plus in buyout
And
so
the
far.
last guy, he's like, I would like to bring a semi-load of horses. That means we'd be intercepting them, a truck from going to Mexico. And he said, like, when's the next buyout? He's like, I could bring you a semi-truck next week. I mean, that's how these slaughter pipeline guys work. Watch for a fundraiser for rescuing a entire slaughter truck, semi-truck of horses. So that is coming up, and of course we said that we will do our best to make that happen, because that's a whole semi-truck of horses we can intercept. We've done that already here today so far, but to be able to intercept a slaughter truck, we've only done that once in our 21-year history, so that would be a really huge accomplishment if we could start rescuing semi-loads of horses and keeping them from going direct ship to Mexico. We need your support. It's a lot of money to get that many horses. So please donate, keep these rescue missions going. We can't do it without your support. All right, so we just got radiographic evidence back on this paint guy, and he's very sweet, but unfortunately he has severe rotation in his P3 and his coffin bone. And he has lipping and osteophyte formation. He's very painful, so he's had active and chronic founder laminitis episodes over and over and over again. So unfortunately, because he's so painful and there's nothing we can do to fix it at this point, last act of kindness is probably my recommendation for him, unfortunately. Okay. This poor guy is really suffering. They've taken x-rays of his feet. His feet are in horrible condition. He does have a crust up here on his neck where basically at one point he was so fat that it just kind of fell over. And so he has just a lot of health problems along with a heart murmur. And we can't control his pain when the coffin bones drop to such a horrible extent. So there are some foundered horses we get and we're able to treat them, but the most of them that we see are just so horrifically foundered that we can't do anything other than give them the last act of kindness. And he's such a beautiful horse. It's really heartbreaking, but I'm so thankful that he ended up whatever situation it took for him to end up with the person that had him that utilized our program, because he would have gone straight to slaughter. And if you can just imagine this beautiful, sweet horse that loves people having a horrific death in Mexico, it's just heartbreaking. So we'll be relieving his suffering. It's the only gift we can give him.
We're all back from lunch. We're back to rolling. We just had a little staff meeting. Corey is our lead rescuer, and he's got a lot of great ideas for speeding up the process. And hopefully we can get all of the horses intake. I won't be able to hang out with you all day because I have to actually get this edited and uploaded. But I'm going to stay up here, see some more of the horses go through. I'm going to keep videoing for you guys. So I hope you enjoy this video. And so super exciting, not including this one. We're actually going to do two different videos about the buyout program intake. One of them will be in Horse Shelter Heroes, and then we're going to do a standalone one that's going to be longer and a little more in depth. So yeah, we really want to start letting you guys know what's happening at these buyouts, because we're saving a lot of horses, but most of the horses have catastrophic injuries and disease. So here's one that Corey's bringing out, and it's almost like it's bad enough that when there's a horse that doesn't have catastrophic problems, there's a cheer that goes up, and it's sad, but we're helping the horses, and if we didn't, they'd be going to slaughter. So thank you guys so much for your support, and I'm going to get back to the assessments. So how's this horse looking, Keith?
I know nothing. I'm just a holder.
Okay, you're a horse holder.
I'm just a holding the horse. He looks pretty calm.
Let me open this for you.
You should be able to just push on it. Oh, it is locked. Oh dear.
Well, I think it'll be on the other side anyway.
Nice big horse. But unfortunately, his back right leg is doing horrible. I'm working gates and a camera, y'all. It's pretty awesome. Let's do this back gate. Look at that leg.
Oh, you were so close.
So bad. This leg is just unbelievable. And it smells really bad too.
So with the size of this horse right here, it definitely would have shipped to slaughter. This probably would have yielded quite a bit for somebody at the slaughterhouse, so we're very happy that we were able to intercept this horse before it went there.
How much did he weigh?
1,400 pounds.
It's a heavy horse.
It sure is.
You guys want? I have some SWAT that I could go grab. Back up a tiny bit. Your focal distance isn't quite right. Yeah. Okay. You guys want to keep moving down? Yeah.
Smells so bad.
And let's take one a little bit further down, and then this draft mare is super sweet. She had a very putrid towel taped to her right hind leg, and she has a very significant infection in that right hind leg. But she doesn't have evidence that she's septic, that the infection has gone systemic. We did pull blood for a complete blood count, and we're gonna take a look at that this afternoon. She needs pretty significant surgical debridement of that wound and exploration of that wound. But even though she had a minor fracture in her leg, that fracture is stable. So I think that we have a chance of saving her. We hope that we can. We won't know until we have her in there. So we're gonna move her to our vet hospital for a quarantine period and do a lot more treatments on her tomorrow. We need to get antibiotics and anti-inflammatory pain medication started right away. And then we will follow up with you guys once we have her sedated and know better what's going on underneath that wound.
Already microchipped. Got Exceed on board. Dr. Lydia said put him in the stall for now, but.
Do you want her in the stall or do we want to take her down to the vet barn?
If there's somebody to take her right to the vet barn, I would say let's go
Just
for
no touching noses with anybody.
No touching. No.
Oh, bye, Keith. You're gonna go with them, Haley?
All the way down?
If you want to follow that horse. Thank you.
Yeah.
I'm trying to check these out.
He looks like he might belong in the
Let me do it. He is definitely old.
I would say so. Oh yeah, look at that angle.
30
Yep.
from here.
Yeah, I agree. Come on, this old man, he deserves it.
Let's take some dental rats. Sure.
His nose is different.
And maybe a left forelimb series, maybe.
Oh yeah, he can't even chew that. Oh, buddy.
He wants to really bad though.
Yeah.
There's poor guy. Can't choose cookies.
I know.
You want to get a look in the mouth if I open it up?
With the cookies in the way.
Poor guy. They're all coming out.
You can't eat them anyway.
Oh,
Fortunately.
buddy.
I don't think it's down to gums.
Yeah, he's worn to the level of gums. He's missing. It's like molar on the upper left. Sorry, Corey.
It's fine.
Poor old boy.
Been hit harder than that.
Sorry.
Pretty soft.
What did you think about his age?
You said 30 plus.
Yeah, I would agree with that.
Cutie pie. Sweet old man.
I think it probably works.
Maybe a face x-ray. So this poor guy is in his 30s. He's lame, super lame on his front, and he's missing a lot of teeth. And with all his medical conditions and his age, the last act of kindness is the kindest option we can do for him. When I worked at a vet office years ago, if somebody brought in an older horse and was like, I want to do right by my old friend, I want to put him to sleep, you know, and he's in his 20s, approaching 30s, it was, thank you so much for being responsible for your horse, and that's something this horse's owner failed to do for him. So we're stepping into those shoes. It's just really sad that he has been suffering for so long with this chronic pain. Like, we tried to feed him cookies, he couldn't even chew the cookies. So it's really sad.
It's almost 4 o'clock. We're still working away. We're still getting horses intaked and assessed, and yeah, I'm not sure. Pretty soon I'm gonna have to go edit this video. Maybe I'll be able to stay till we're done. I'm not entirely sure, but I definitely got to get this video out to you guys tonight so you can see what your donations have done. So thank you guys so much again for your support. We definitely still need support. So if you don't mind, hit that donate button, go to our website, horseplus.org, help us out a little bit. But we've been helping a lot of horses today. A lot of horses coming through the buyout program, and we've just been getting them what they need. So this looks like a Mustang.
Yeah. Okay. That was his 5-way vaccine. This is a 4-year-old Mustang gelding. He's been a very good boy. He doesn't have any major health concerns that we have seen so far, so he's getting full intake.
Got a couple of littler ones, a donkey and a pony. And the donkey seems really sweet. The pony's a little skitterish and a little bit wild. But hopefully they're both really healthy and able to go on and be adopted. Hi, donkey. You're so cute. Yes, you are.
Wait. Don't go anywhere. Wait.
It's Route 2.0. Did it have lice for you?
Probably.
Those babies.
We're hoping this here donkey's a very nice donkey.
You're so cute. Look at that head.
Oh, they're all baby
That's what I thought.
teeth.
Like 2?
Yeah.
No, younger than 2.
Yearling slash
Baby, yeah.
Like
Yeah.
6 months.
Under 12 months. Yeah.
He's huge.
Under 12 months old. That's so cool. He's going to be huge. Donkey needs to come in the chute. Come on, donkey.
I need another butt rope, please.
He's dancing.
That will work great. Keep it.
Donkey still needs to come in the chute.
Come on, little baby.
Yay, donkey's in the chute. Good donkey.
Great work.
And that donkey's going out to wait to be put into a pen for quarantine. Did you get everything done, donkey? It's such a sweet little donkey. Probably going to be going out to the 10-acre pasture. Well, folks, I'm going to go edit this, get it uploaded for y'all. The team is still busy intaking horses. There's still a lot of horses. Let's go see. We got 1, 2, 3. Got some horses there. And way down there, that's a bunch more horses that they have to intake. But I'm going to go get this edited. But on the way, I'm going to go past the green pasture with horses grazing happily that we rescued today, thanks to donors. And here comes Tawny, so I'm going to see if I can get her to say something real quick.
Just want to thank every single person who donated to make this rescue mission possible. If you haven't donated, I just would plead with you that you'd make a donation. Like I've mentioned before, donations are down this month, but there's always horses that need help. And we will continue to rescue large amounts of horses if we have funding to do so. So please make a donation. There's a lot of horses here today and a lot of medical professionals and 2 veterinarians. It all costs a lot of money, and your support is critical to make happy endings happen for these horses. And throughout the day I've been walking out and seeing the horses when I walk out of this barn and seeing them in the pasture and they're eating and they're happy, and that's amazing, and it's what we have to take to heart. And please keep those donations coming. One of the people who brought horses today said I can bring a semi-load next time, and that's intercepting an entire semi-load from going to Mexico, and we need to make that happen, and I know we can count on you to make that happen. So thank you so much, and enjoy watching the horses that are already intaken out in the pasture grazing. We still have a lot more we're doing, but if Jason's gonna edit this video, it's gotta stop somehow. But we will be releasing a new episode that's a standalone auction episode, and Haley and Macy are up here filming, so you'll be able to see the whole thing when we release it. So
Standalone buyout.
Okay. We're going to be releasing a standalone buyout rescue mission episode, so you're going to want to watch it. If Jason's going to be able to edit all of this, he's going to need he's going to need time to go edit this. So thank you so much for your support. And my phone's
they have it.
Yes,
so.
they have it, and you'll be able to watch it. So thank you so much for watching, and please make that donation. Help us continue to rescue large numbers of horses out of the slaughter pipeline.
You don't mind walking him out there and holding him and let me get past? Or you turn him loose?
Look at all this space you got, man. It's pretty cool. It's pretty cool.
All right, whenever. He likes you.